Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Get CME for this episode by clicking on the CME link in the show notes. Today, we welcome Tami Burdick. She is a patient advocate and author of Diagnosis Detective, Curing Granulomatous Mastitis. Her Kevin MD article is titled From Business Trip to Battling a Rare Breast Disease, My Journey of Survival, Advocacy, and Remission. Tami, welcome to the show.
Thanks for having me. Pleasure to be here.
So your story goes right into your Kevin MD article. So let's start there. Tell us your story and journey.
Yeah, so I left on a business trip as a freelance business consultant and would come back with an unwanted gift. I ended up contracting an environmentally associated bacteria while I was on that business trip that would then cause a chronic inflammatory breast disease known as granulomatous mastitis. But the journey to getting those answers was how I became known as the diagnosis detective. And a lot of people that I've interviewed with said you remind me a lot of Aaron Brockovich. And it's kind of a Aaron Brockovich-like story for sure.
So tell me the start of your journey. Tell me how this presented, what you were feeling, and what led you on this path.
Yeah, so I started with a variety of symptoms, flu-like symptoms, as well as pain in my right breast. And then that prompted me to do a self-breast exam. And upon that self-breast exam, that's when I realized there was a hardened area and a lump. And so I wasted no time in contacting my primary care physician, and everything just escalated from there to a mammogram, to an ultrasound, as well as a core needle biopsy. And at first, my medical team thought I had breast cancer because I was BI-RADS 5, so highly suspicious of breast cancer in medical terms. While I was relieved with this feeling of, excitement and happiness that it wasn't breast cancer, I had no idea what journey I was about to embark on. And it was a lot of painful, draining abscesses, and it was a very long, exhaustive journey for sure.
During this time when the diagnosis was in question, just tell us about the interactions that you had with your medical team.
Yeah, so I went to an infectious disease specialist who, honestly, when I look back at everything, I felt that I was probably more well informed about the condition than she was. I had done a lot of independent research prior to that appointment just so I could feel more empowered and more prepared to be able to ask her the right questions. And while she was willing to work with me on some of those tests, we did do some urinalysis, we did some blood work and some other things. It was the diphtheroid bacteria that was found in my original culture that she dismissed. And that's kind of where the negligence part happened, or where I like to say the missed opportunity was for me to get the proper treatment early on instead of 7 long months later. Had the infectious disease specialist not dismissed that finding as just a contaminated sample or part of my natural skin flora, and she ran the right testing, we would have found out that that bacteria was indeed pathogenic to humans, called Corynebacterium croppenstedii.
For those who aren't familiar with granulomatous mastitis, what is that?
So it's a chronic inflammatory breast disease that's affecting roughly around 2.4 women per 100,000 population, I believe. While it's more prominent in women, men aren't excluded from the condition. However, it's more common in women. It's affecting women from all over the world in a multitude of different countries, including predominantly here in the United States. There are a lot of underlying causes, and I think that's where the medical system kind of fails on their part, is really doing the exhaustive testing to identify all of what those potential underlying causes can be. Because the key to granulomatous mastitis is finding out what could be causing it to begin with. Because finding the cause gets the patient proper treatment, and that's when the patient has an opportunity, like I did, to get cured.
So you mentioned that this was a 7+ month diagnostic journey. So tell
Yes.
us, how eventually was this found?
So I did more research and I came across a pathology test known as gene sequencing. And luckily, I had a amazing surgical breast oncologist who was willing to partner with me. And she said, without any hesitation, let's go ahead and do this test. And so we did that test, and it was then that we finally got an answer after all of those months that it was indeed that bacteria. And my journey kind of didn't stop there in looking for answers. That's when we started tracing my steps. And through process of elimination, we were able to trace it back to that business trip. And a rare and shocking part of the story is it was actually from a shower at a hotel that I was staying at.
Wow.
Yeah.
Is that a common form of transmission just from your research?
So in an interview that my doctor and I have done together, she said while it's possible, it's not as common. She believes that things like areas like flooding and sewage breaks and things like that of that nature, or even oceans or polluted lakes, that's probably where you're going to see more opportunity for certain infections like I had causing granulomatous mastitis.
And what's the treatment course for something like this?
So, my treatment in particular, because there was a significant delay, I had 9 months total of doxycycline. We did do susceptibility on that. So, we were told that doxycycline would probably be the best course of treatment. And then at the 6 month mark of that antibiotic therapy, that's when my surgical breast oncologist felt it might be a good opportunity for us to go ahead and proceed with surgery. That surgery in layman's terms is basically kind of like a cleanup surgery where she went in and removed any unviable tissue and then flushed my breast with antimicrobial so that I could heal from the inside out. And that's kind of like the last part of my journey to help me reach remission. But I did have a wound vac for about 6 weeks. Honestly, that was probably the worst part of it.
And during this journey, talk to us about some of the emotions that you were feeling, some of that frustration and disappointment with the healthcare system. Talk about what you're going through emotionally as the
Yeah.
diagnosis was in question.
Yeah, so there is a definitely an array of emotions that women feel with this disease. Obviously with the healthcare system, there's a lot of feelings of that we're experiencing medical gaslighting or being dismissed. And, maybe it's more so under practice, but there's so much more information out there. And obviously, including my book, that's a valuable resource that can really help doctors get a better grasp on this condition. But you're feeling sad, you're feeling depressed, you're feeling why me, you're feeling angry. It is very exhaustive. It's wound care 24/7 almost. You get up and you wound care after you take a shower, you wound care before you go to bed. And it's very unpredictable and that causes a lot of frustration. So there's kind of like that up and down or teeter totter of emotions for sure for anyone going through this condition.
So I do internal medicine primary care, and I don't think I've come across this before. What are some tip offs? What are some things that I should look out for to have this in the forefront of my mind? What part of this story should I be looking for?
Yeah, so in terms of primary care, obviously, any breast abnormality, whether it's a small lump or the hardened area like me, don't hesitate in making sure that the patient gets the proper testing because you don't know, for one, even if you're going to be missing a breast cancer, and that's important. And I think we're starting to see a lot more younger women even getting breast cancer. And even with GM being a benign chronic inflammatory breast disease, the longer the chronic inflammatory process continues, the higher risk of potentially developing breast cancer from this disease. And unfortunately, that's been proven for several women in my support group for the condition. So, from a primary care perspective, don't hesitate in getting a patient a mammogram or an ultrasound or an MRI, something to make sure that they're not missing some sort of abnormality. Lucky for me, I had a great primary care physician as well. She ordered both a mammogram and an ultrasound after that initial clinical appointment with her.
So we talked about your interactions with the healthcare team. So I just want to share what kind of messages do you have for us in terms of what we could do better, but also on the flip side, you've had some positive experiences too. So what are some things that we did well during your journey?
Yeah. And I don't want to necessarily come across like I'm trying to blame doctors. I think a lot of times it can be these medical networks. They put a lot of pressure on our healthcare professionals, get as many patients in a short amount of time as possible. At the end of the day, it's a business too, just like anybody else, right? But I think when it comes to healthcare, if you just really truly listen and believe your patient and have a partnership approach relationship, I think that's going to give you a lot of better results. And just like any review on a product on Amazon or any other review on any other website, any doctor, you can leave a review with them on the internet. And I think if more doctors actually took the time to see what their reviews were on the internet, they might themselves become a better doctor. But the
Yeah.
positive experience that I had, I had an amazing surgical breast oncologist because we had that partnership alike approach. And she was willing to listen, willing to, review my research. And that really kind of proved the positive end result for me. And we also incorporated a functional medicine practitioner in on my case. So the three of us, we kind of call each other the A team. And it was the three of us that really got to where I am today.
Now, as you reflect on your experience, is there anything that you wish you would have done differently?
Well, I wish the infectious disease specialist would have done more due diligence on her end to really rule out, instead of guessing, confirming that diphtheroid bacteria finding was, what it turned out to be. I look back thinking, had I got proper treatment, in April instead of starting proper treatment in October, things could have been very different for me. Perhaps I could have avoided surgery.
Now, you share your story, of course, in your book, Diagnosis Detective. Tell us some of the main points that you want readers to come away with after reading your book.
I want readers to know that they have to be their best advocate always. And I also want them to know that they're not alone. And while the book is obviously a great tool and resource for patients, but it's also written in a way to be invaluable for our healthcare system. So I look at my target audience as not just patients, not limiting to patients, but also medical professionals. And I've had a lot of medical professionals, including surgical breast oncologists, purchase my book. So,
Now, when you say that patients need to be their best advocates, what are some
yes.
specific ways they can do that?
So I came up with my A list for advocacy, but it's definitely making sure that you form the best healthcare team to work with. If you have a premonition or a feeling about a doctor that you're just not comfortable with, get a second opinion, get a third opinion, I don't know how many opinions you need until you feel comfortable that you've partnered with the right medical team. Really do your own research. It's just as important for you to become familiar with the disease than it is for the doctor, because doctors have a lot of patients, right? They're not going to be the experts in everything. Like you said yourself, you've never even, really seen or heard much about GM before. So it's really just being as prepared as possible.
We're talking to Tami Burdick. She's a patient advocate and she's the author of Diagnosis Detective, Curing Granulomatous Mastitis. Her Kevin MD article is titled From Business Trip to Battling a Rare Breast Disease, My Journey of Survival, Advocacy, and Remission. Tami, tell us some of your take home messages that you want to leave with the Kevin MD audience.
Takeaway messages, obviously, if you're a female and you're just wanting to learn more about breast health, or this breast disease in particular, feel free to get a copy of my book, share it. But my best advice to anybody is just always be your best advocate. No one knows your body better than you do.
Tami, thank you so much for sharing your time, story, and insight. Thanks again for being on the show.
Thank you.